Alright, so inspect the face, make sure that it's symmetric, there's no blemishes, inspect the scalp, no nodules, hairs evenly distributed, no thinning, no pain with that. Alright, then we're gonna inspect temporal artery. That's good. Now, the temporal mandibular joint. Alright, no clicking, everything's fine. The cranial nerve 5, you're going to clench your teeth and hold. Clench them, hold it. Alright, good deal. Alright, and then I'm going to take a Q-tip. Once you close your eyes, tell me when you can feel this. Feel it. Feel it. Alright, now I want you to smile, frown, close your cheeks, close your eyes, lift your eyebrows, and that is for checking for the cranial nerve 7. Can you show your teeth? Okay, good deal. Now we're going to do a corrective lens chart check. I'm going to go about 10 feet and let me know what you can see. Do you wear corrective lenses?
No.
No, okay. Can you read the smallest line?
SKJMLN.
Cover one eye. Read it.
SKJLMN.
Alright, now cover the other eye. Can you read the smallest one again?
SKJLMN.
Okay. Alright, so now we're going to check the pupils, make sure they're reactive. Alright, and now they're good, they're reactive at a 4, and they are equal, and your irises are green, your sclers are white, everything's good. Now we're going to test the extraocular movement. I want you to follow my finger with your eyes, not your head. Alright, that's good. Now, I noticed that your eyebrows, eyelashes, and everything's good. Hair is evenly distributed. We're going to check your ears, look in them, make sure nothing's going on there. And now I'm going to do a whisper test where I just want you to repeat whatever you can hear me say.
Red. Blue.
Okay, good deal. Now, we're going to check your nose and inspect, make sure there's no drainage, there's no lesions and nothing going on there. No drainage, everything's good. You open your mouth for me, look at the hard palate, then soft palate, tongue, teeth. Can you say ah? Alright. Alright, so now I'm going to check your sinuses, make sure that they're good. You tell me if you feel any pressure or pain. No? The frontal one? No? That's it. Alright. No. Good deal. Now, for your mouth and throat, there was no issues with the teeth, the gums, the tongue was symmetrical, there was no drainage, it's pink and moist. The gag reflex did rise. Pharynx was normal, everything was symmetric. Now we're gonna check your lymph nodes. We're gonna check for pre and post auricular, occipital, submental, submandibular, and tonsillar and superficial cervical, as well as the posterior deep and cervical chain. Don't feel anything hard, no lumps. Feels good. Everything is great. Didn't feel any hardness, no lumps. Spongy moves. Now we're going to check for cranial nerve too. So if you could, I need you to put your chin to your chest. Alright, now do your head side to side. And lift your head up. Turn side to side. Now take your ear and take it to your shoulder. Now the other side. Now can you extend your head back? Alright, now back up. Alright, so now I want you to shrug your shoulders with me, resistant. Okay, good deal. Now we're going to check the thyroid and trachea. We're going to check that it's midline and symmetrical. Going to check the posterior approach. So I'm going to have you turn around. Well, I'll come around you. And
No,
I'm gonna,
turn this
I'll
way.
come, no, you can stay there. I'm going to come around you. Let me get you something to drink. Okay. And we'll come behind you, and I just want you to take a drink of that so I can feel.
Go away.
Okay. Alright, good deal. Okay. So when you have checked to make sure that she could swallow the water and it moved freely, there was no abnormal hardness or any nodules or anything there. Now we're going to check the carotid pulse. We're going to inspect it and make sure to listen to it. There's no fluid and that everything is regular and not bounding. It's regular, not bounding. Okay. I'm gonna listen to it with the small bell of my stethoscope. Okay. It's good and regular. There was no abnormal sounds to it. Now we're going to check the chest. This is where I'll need you to turn around and just stay still direction. Alright, so here we're going to just making sure that, as y'all can see, everything's symmetric and good. It doesn't look like there's any nodules or anything on there. We're going to palpate to make sure there's no pain and palpate the tactile fremitus check. Make sure it's symmetric. So, I'm just going to look and feel. Nothing abnormal. Now what I want you to do is, as I move down, I just want you to keep saying 99.
99, 99, 99, 99, 99, 99.
Alright, and everything was good. The vibrations were good all the way throughout. It was symmetric. Now I'm going to do percussion on your back just to make sure that there's no abnormal sounds and that it's symmetric all the way through with percussive and in all 8 areas. Alright. Now we're going to listen to your breath sounds, make sure that they're clear. And just breathe normal in and out. Alright. It was clear. There's no wheezing, no crackles, nothing that I could hear there. Now I'm going to take my fist and hit on each side to determine if there is flank pain related to any tenderness or pain for the kidney area. No pain? Nothing? Okay. Alright, now you can turn back around for me. Now we're inspecting the front of the chest. Everything's symmetric. There's no issues there. Don't look like any nodules or anything that's abnormal standing out. I'm going to check your radial and your brachial pulses and make sure that they're good. Like that. They're regular, not bounding, they're good. Then now we're going to check your cap refill. Less than 2 seconds. Breast. Looks good. We're going to do some range of motions. You put your arms and go above your head. Watch them lights. Alright, now bring them down. You can bring them behind you. Alright, now out to the side. Everything good? Nothing doesn't hurt? Alright. Now we're going to check your elbow reflexes. So if you can just extend them and then bend them up. Alright, now bend them out. Alright, now bring them up. Don't fall off the table, by the way. Alright, so now what I want you to do is hold your arms out and pronate and sonate your arms, okay? Good. Alright, so I want you to, we're going to check to make sure that your reflexes are good. So I want you to make fists, hold your hands out, make fists. Now open them. Alright, now can you touch each one of your fingers to your thumb? Alright. Now what I'm going to check is your cerebellar function. So if you can, kind of like how they do with, I'm going to call it puyo, where you got to hold your arms out and touch your finger to your nose. Hold them straight out. Touch your finger to your nose. And then the other one. And you can do a little bit faster. Okay. Everything's good. Everything's working properly. Your gravitational function, I want you to close your eyes and hold your palms out and up. Up. And I'm going to draw a number inside of your palm, and I want you to tell me what number that is, okay?
3. 8.
Good deal. Now we're going to check your sterignosis, which is where I just want you to hold your hands out and I'm going to place an object in there, close your eyes. And just by the feel of it, if you can tell me what that object is.
Chapstick?
Alright. No, I got this one.
This is a cup or a top.
Top. That's good. Okay. So, that looks fine, everything's good there. Now I'm gonna test the reflexes of your arms, so if you can, just hold your arm up and just let it lean right there. So what we're testing first is the triceps, which is right back here. So I'm gonna hit this and it's gonna feel a jump right there, but just as long as you keep your arm relaxed, just relaxing the line. Alright, now I'm gonna test your bicep reflexes. So again, just let it hang, and just rest it on mine. Alright, and now what I want you to do is just hold your wrist like this and move your watch up. And I'm testing the brachial reflexes and watching for the thumb to twitch. Alright, let's do the other one. Just let it hang. Alright. Now, we're gonna check your chest, listen to your lungs, your heart. So I'm gonna have you lay back, if you would, on this pillow. And alright, so I'm gonna just look and everything looks good. Stand aside. Breathing is non-labored, symmetrical, breathing fine. There's no issues there. I'm gonna listen to your heart sounds. We're gonna listen to the aortic, which is on the right, and then we're gonna move over to listen to your pulmonic and tricuspid in your mitral. You can hear that S1, S2 good. No abnormal sounds. Now I'm going to turn it over to the bell side to listen for murmurs. Alright, sounds good. No heart murmurs noted. Now I'm gonna, my hands are probably cold, I'm sorry. I'm gonna inspect your abdomen and I'm gonna inspect it, then auscultate it, percuss, and then palpate it. Everything looks good. Everything's symmetrical. Don't like any hernias or anything there. Then I'm gonna listen to it. Don't see any pulsating in it. I'm gonna listen to all 4 quadrants. Everything sounds good. It was not slow or too hyper. Everything sounded good. Now I'm gonna percuss, which I'm gonna use this little tool and hit on different areas. First let me use the bell side so I can listen for your renal arteries and your aorta. Alright, everything was good on that. No issues with the renal artery on either side or the aortic artery there. Now I'm gonna use this to percuss different areas where there's major organs to make sure that they're doing good. Everything sounds the same and symmetric all the way through. Nothing abnormal there. Now I'm gonna palpate each one. I'm gonna start off light first and then go a little bit deeper, okay? And just let me know if you feel any pain or tenderness. Nothing?
No.
I'm gonna go a little deeper. Nothing there?
No.
Alright. I'm gonna check over to your right side under the ribs here for your liver, okay? I'm gonna push a little hard. I don't feel any hardness, no swelling or anything there. So that's good. Now you got your socks off. I'm gonna check for the Babitsky's reflex. You can just relax your feet. It's gonna feel weird. Alright. The toes did not curl up and fan out, so that's good. They come down, which is a good sign. Now I'm gonna check your legs for edema, and I'm gonna palpate your popliteal pulse and your tibial pulse and your dorsal pedis pulse. Everything's good. Move so you can see what I'm doing. That's good. Good. That's good. No edema. Nothing abnormal. Alright. So now, if you could, I want to check your range of motion. I'm going to get you to raise your left leg up 90 degrees. Alright. You put it down. Now do your right one. Alright. Now can you bring your knees to your chest? Alright. Now I want you to rotate your knees outward. Leave them flat and just rotate your legs out. Now inward. Is there any problem with that? Does it feel uncomfortable? Alright. Now I'm going to check, get you to sit up if you would, and we're going to check your Achilles tendon and your patella. Just hang your legs for me. Alright. Alright. I'm gonna check your cerebellum function. So if you can, rub your heel down your shin. And do the other one. I'm gonna get you to stand up for this one. Alright, I'm gonna get you to, I want you to walk that way on your heels to the end of the rug and then walk back on your tiptoes. And then turn around and walk back on your tiptoes. Okay? Alright, so now we're gonna do the Romberg test. I want you to stand this way. It's right here. Now all I want you to do is just hang your arms by your side and just close your eyes and stand there. Alright, that's good. Now, can you hop on one leg for me? Alright, now hop on the other leg. Now can you bend forward for me? Alright, spine is straight and no curves, no issues there. Can you touch your toes? Alright, then raise up. Can you bend side to side? Any problems with that?
Ooh, no.
Alright, that is it. That concludes our head to toe assessment. Thank you very much.
Thank you.